Welcome to the inaugural episode of the Charles River Orthodontics podcast. Today, Dr. Khedkar is going to talk about what Invisalign is and all the different ways it can help improve your smile. Dr. Khedkar, can you tell us what Invisalign is and how it works?
Sure. So Invisalign is a clear aligner alternative to braces. It's something that's really come a long way over the past 10 to 15 years. And basically, the way it works, it's a series of clear aligners that slowly guides your teeth into the correct position because each aligner that you get is shaped slightly differently. So it's a really comfortable and effective way to move your teeth. That's a great alternative to braces.
So, which orthodontic issues does Invisalign address?
One of the great things about Invisalign is that most orthodontic issues can be treated with Invisalign. You know, back in the day, it was only minor cases that could be treated effectively with Invisalign, but after all the innovations that have been made, the majority of cases can be treated just as effectively with Invisalign as you can with braces, some actually even better with Invisalign. So it can correct crowding, spacing, open bites, overjet, underbites. So really every type of case, just depending on the amount of movement that's recommended, can be treated with Invisalign.
Well, so how does it treat underbites, for instance, compared to regular traditional braces?
Basically, because when you're fixing an underbite, it's just the movement is the same whether you're doing it with Invisalign or braces. It's just a different way to correct the movement or to achieve the movement. With underbites, you're trying to move the lower teeth backwards and the upper teeth forward. So whether you're doing that with braces or Invisalign, it really doesn't matter. And actually, in some cases, Invisalign does tipping movements a little bit better. Now, one of the most important things is case selection. So depending on how much movement needs to be done, how much is root movement, how much is crown movement, that's ultimately going to factor in if you're a good candidate for Invisalign. But again, most cases can be treated with Invisalign that can also be treated with braces. In some cases where we have a more severe underbite, we use Invisalign in conjunction with another appliance called a motion appliance, which is basically just these little bars that are bonded to your back teeth on the bottom, and you use those to wear rubber bands off of your upper Invisalign. So that can help with more advanced underbites. Now, in some underbites, it is a situation where it requires a surgical correction. And even in those cases, we can do some of those with Invisalign and surgery and braces. But in terms of the movement itself, we can achieve those with braces, with Invisalign. It really is just how we're achieving that movement.
So, can Invisalign relieve TMJ symptoms and how so?
So that's a really good question. TMJ or TMD, the disorder itself of your joint, has a lot of causes to it. And people sometimes have some of the causes, all of the causes. It's really multifactorial. One of the contributing factors can sometimes be your bite. So sometimes if you have a bite that is off, you have an interference or a shift because of it, that can exacerbate your symptoms. And if that's the case, by correcting the bite, with Invisalign, you're actually going to help to improve your symptoms. So it really just depends on the causes of the TMD. And then if your bite is a contributing factor, then by correcting it, definitely Invisalign will be improving your symptoms.
Well, so how would Invisalign manage something like crowding?
So with crowding, which Invisalign works really well for, the way it works is that each aligner, again, because it's a slightly different shape, is slowly pushing your teeth into the right position. So it's first creating space for the teeth to go into, and then it guides those teeth into the correct position little by each tray. It's the same thing with spacing. Basically, it's just guiding the teeth. And what's really important is that we are planning out the movements ahead of time so that we make sure we have the space or the room or the bite necessary to achieve that correction.
Well, is Invisalign effective when you have a gap in your teeth?
Yes, so Invisalign can definitely treat spacing. It works. I've treated a lot of spacing cases with Invisalign. Now, some of it also depends on the amount of space closure. So When you have a large space to close, sometimes with root uprighting, we may need to involve some additional either buttons or potentially a short course of braces, but that's really only for very large spacing. With mild to moderate spacing, Invisalign works really well with space closure.
So there are times when you'll have a short term of braces and then you'll move into Invisalign throughout your
Yeah,
treatment.
so and then sometimes because we want to minimize the time in braces for a lot of people, especially adults. So if we need to use that, we will usually either do a short course at the beginning or the end to achieve those root movements that we can't predictably achieve with Invisalign. And again, there's not a lot of movements, but if we do happen to have those movements, then it's something that we can do just a short course of braces, and then we can do the remaining predictable movements with Invisalign. I've done that with a lot of adult patients. I've also done some hybrid cases. So, like if we can do Invisalign on top and braces on the bottom, if there's some movements on the bottom that can't be achieved with Invisalign. That way you get the aesthetic benefit, but we're still getting the proper movement that we need on the bottom that we would need braces for.
Okay. Well, so can Invisalign treat open bites, or what are its limitations?
So open bites are actually better treated with Invisalign than braces. So that's something that we prefer using Invisalign with open bites over braces. And the reason is that Invisalign is actually more effective at creating intrusive movements of your back teeth, which is how your open bites are corrected. Braces are actually better at extrusive movements. So when I have an open bite case, I prefer to use Invisalign. It's really more predictably and effectively treated that way. And I've treated a lot of open bites successfully with Invisalign.
So how does Invisalign treat crooked teeth, and what's the normal timeline?
Sure. So crooked teeth, same thing as crowding, where it's basically creating the space for the teeth to go into and then slowly guiding the teeth into the correct position. In terms of timeline, it really depends on the amount of movement that needs to be achieved. So in most cases, more movement would equal a slightly longer timeline, just basically because the teeth have to move farther. But our average cases are about 12 to 18 months. And there's a range. So we've had some minor cases that can be finished in 6 months. We've had some more involved cases which take a little bit longer, but I would say our average case is anywhere between 12 to 18 months at the longer end.
What about teeth that are not fully erupted? Can Invisalign help with that?
Sure, that's a great question. We have treated a lot of younger patients with Invisalign. That's actually becoming a lot more common just due to the fact that it's a little bit more comfortable. There's less emergencies, so the parents don't usually have to come in as often. But what happens is for teeth that are not fully erupted, we will build in space into the aligner for the tooth to be able to erupt further and actually can help to guide the eruption of that tooth. So we've treated patients as young as 8 years old with Invisalign. We've treated patients who have some baby teeth and some permanent teeth. Basically, it's just planning in the eruption and creating space for those teeth to come in.
So when we're closing gaps, how do you compare Invisalign versus braces when you need to do that?
So it really depends on the amount of space closure that you need. So if it's a large amount of space closure, then sometimes braces will be a better option just because we need a lot of root movement with it, or at least a short course of braces. But when you have, mild to moderate spacing, it works just as well as braces would, because it's really just a matter of how you're moving the teeth, not what you're moving the teeth with in those cases.
Can Invisalign correct overjet, and how does it do that?
So it can. It can definitely correct overjet just as effectively with braces. So one of the things that we use to correct overjets is rubber bands or elastics that go between the top and the bottom. And you can use elastics with Invisalign just like you do with braces, because that's an important part of the bite correction. With Invisalign, the only difference is you're hooking the elastics onto the aligner themselves rather than the braces.
So is Invisalign capable of widening a smile?
Definitely. So we actually do that a lot, especially for adult patients. Sometimes, if they've noticed over time that they feel like their smile is getting a little bit narrower, or even younger patients that have a naturally narrow smile, the way it works is it can broaden the smile by tipping the teeth outwards so that we're uprighting them over the bone. So that's a common movement that's really effectively achieved with Invisalign to give you that broader, more aesthetic smile.
So in your opinion, what are the advantages of Invisalign over braces?
Sure. There's actually a lot of advantages. So one of the advantages is that it's, one of the main things people cite are the aesthetics, right? You have a clear aligner on your teeth. You don't have brackets and wires, which, overall people would prefer in most cases. The other advantage is that you don't have to come into the office as much. So with braces, we have to adjust your braces periodically. So usually it's every 4 to 6 weeks that you're having to come into the practice for us to adjust it. With Invisalign, because of the way that a lot of the treatment planning is happening at the beginning, we usually see you less often. So we're seeing you every 10 to 12 weeks, and we combine that with some virtual monitoring as well. So we're still keeping a close eye on you and making sure that you're progressing properly, but you don't have to physically come into the practice as often, which is nice for a lot of people who don't always have the time to make it for appointments every 4 to 6 weeks. Another advantage is that there's really no food restrictions with Invisalign, and it's also easy to clean your teeth because you're taking them out when you eat and when you brush and floss your teeth. So you don't have to worry about staying away from hard, crunchy foods or staying away from sticky food. Really, there's no food restrictions, and also with flossing and brushing, since you're not having to work around brackets and wires, it's a lot easier. And then another advantage is that we really have fewer emergencies. With braces, sometimes you can get a pokey wire, you can have a loose bracket, where you would have to come in for a normally scheduled appointment to have that corrected. With Invisalign, we really have, very few to almost no emergencies, because let's say something happens to your tray, you can always progress to the next tray and wear that a little bit longer, rather than having to come in and fabricate a new tray.
So how do you determine if someone's a good candidate for Invisalign in the first place?
It's really, there's a lot of things that go into it. It has to do with the type of tooth movement that we need to achieve in order to get to the desired result. So case selection is really important. Basically, we're looking at the type of movement, the amount of movement. We're also looking at lifestyle, basically if it's something that would work well. Most people it does, but that's something that we want to confirm with you. But the most important thing is just the type of movement and the amount of movement that needs to be achieved. That helps us to determine if you're a good candidate for Invisalign.
Can you describe the Invisalign treatment process from start to finish for us?
Yeah, so the way that it works is we'll start with taking some records. There's a couple of x-rays, some pictures, and we'll also take a 3D scan of your teeth. No messy impressions anymore, which is great because we used to have to take these big impressions that were in your mouth for 5 to 7 minutes, but now we have a 3D scanner, which is not only more comfortable, it's also a lot more accurate than the impressions were. So we take the scan, we send it to Invisalign, and then we use a 3D interactive software where we're customizing the position of each tooth and also staging the movements. Once we finalize the movements, then Invisalign, the lab, will fabricate the trays and ship them to our office. So that whole process of customization and fabrication takes about 4 weeks. After we receive the trays, then the patient would come in, we would bond the attachments, which are just little bumps of clear filling material, which will go on some of your teeth, normally mostly the back teeth, not every tooth, that work with the trays to achieve the movements. So you'll come in, we'll bond those attachments on, and then give you your first set of trays. And then we see you again every 10 to 12 weeks to monitor movement, give you trays, make any adjustments as needed, and go from there.
So what advice would you give to those considering Invisalign?
Come see us. That's really the best thing, is because we do offer complimentary consultations to patients, to new patients coming in. What we'll do is we'll have you come into the office, we'll take a round of records, and then that same day, we can give you a recommended treatment plan. We can review finances and insurance, and you can technically even get started that same day. That way you're reducing the amount of times that you have to come into the office. We do also offer some virtual consultations. So if it's something that you can't come in for right away, we can do a Zoom consultation where we will look at your teeth, we'll review some information, give you a general idea, and then we can have you come in to take those records that we need to get started.
Well, great. Dr. Khedkar, thanks for coming on the show. We look forward to having you again and learning more about orthodontics.
Thank you so much. It was great to be here. Have a great day.